Did you know that engaging in oral sex can put you at risk for serious health issues, many of which aren't commonly discussed? There's a widespread myth that oral sex is completely risk-free, but in reality, it can expose you to a range of dangerous infections and diseases. In this video, we'll break down the top 5 diseases associated with oral sex and reveal some of the lesser-known dangers you should be aware of to keep yourself healthy. When doctors ask patients about their sexual habits, many people overlook oral sex and don't consider it a risk factor. But this is a misconception. Oral sex can absolutely carry risk, and many who practice it aren't fully aware of the potential dangers. Before we dive into the 5 main diseases linked to oral sex, it's important to understand that the mouth and oropharynx are home to a variety of bacteria. These are the natural healthy bacteria that help with digestion. Normally, these bacteria don't cause problems, they remain balanced. However, when disease occurs, these bacteria can multiply rapidly. Sometimes, even new organisms not usually found in the mouth, such as the herpes virus or HPV, can appear. These pathogens are known to cause different illnesses. Another important point: the urethra, the tube that carries urine from the bladder out of the body, is a sterile pathway. That means it doesn't naturally contain bacteria, fungi, or other germs. However, this area can become contaminated during oral sex, increasing the risk of infection. As a physician, I've seen firsthand how important it is to raise awareness, especially among older adults who may not realize the potential risk. For example, I recently treated Mr. Gerald Thompson, age 67, who developed severe oral candidiasis after a period of what he believed to be low-risk intimate activity. He was shocked to learn the connection, but after successful treatment and making some lifestyle changes, he's now a strong advocate for safer practices and routine health screenings. Another inspiring case is Mrs. Linda Ramirez, age 72, who presented with persistent mouth ulcers. After further investigation, we identified the underlying cause as an HPV-related oral lesion. With appropriate medical care, she made a full recovery. Now, she often speaks to friends and family about the importance of understanding these hidden risks, proof that knowledge truly can be life-saving. Before we go further, if you value your health and want clear answers to questions most people hesitate to ask, don't forget to subscribe, share, and hit the like button. Stay updated, safeguard your well-being, and get honest advice on men's health topics every week. Now, let's continue. Here are the 5 main diseases that can result from oral sex. The first is HPV, or human papillomavirus. There are over 200 different HPV types. Some are linked to cancers of the oropharynx and penis, and in women, cervical cancer. HPV can also cause benign growths, such as genital warts. When HPV lesions develop in the mouth, they often go unnoticed, but can still increase the risk for those engaging in unprotected oral sex. These oral lesions may lead to ulcers, or in some cases, even progress to cancers like penile cancer. The second disease is oral candidiasis, commonly called thrush. This fungal infection can be passed from an infected mouth to other areas, including the glands, foreskin, or urethra, resulting in conditions like balanitis or balanopastitis. Symptoms of these fungal infections include discomfort, redness, flaking, and a burning sensation in the genital region. Treatment typically involves antifungal medications, corticosteroids, or topical antibiotics. Next is herpes. There are 2 herpes viruses that affect the mouth and genitals: herpes simplex virus type 1, HSV1, and type 2, HSV2. Although these viruses don't usually inhabit the mouth, a person with an oral herpes sore can transmit the infection to another person's genitals during oral sex. The fourth disease, fortunately less common, is syphilis. While syphilis is rarely spread through oral sex, it is possible. The hallmark of syphilis is a single painless ulcer with raised edges and a firm base, often found on the glands or foreskin. This distinct ulcer makes it recognizable at a glance. It is vital to treat it promptly, as syphilis is highly contagious. The fifth group of diseases is urethritis, which refers to inflammation of the urethra. These infections are typically marked by redness, discomfort, and discharge. As mentioned earlier, the urethra is naturally sterile. The main bacteria responsible for urethritis are chlamydia and gonococcus. Transmission often occurs via unprotected oral sex. So, how can you reduce these risks? The most effective ways include limiting the number of sexual partners, avoiding promiscuity, and, most importantly, knowing your partner's health status. If this isn't possible, always use condoms during oral sex. Just as you wouldn't share a toothbrush with someone you don't know, you should approach oral sex with the same caution, prioritizing responsibility and safety. Now, I'm curious, were you aware of these risks before? Let us know in the comments whether this information was new to you, or if you've already heard about these dangers. If you found this video helpful, or think it could benefit someone you know, please share it. Don't forget to subscribe, turn on notifications, and stay up to date with our weekly health content. As we wrap up, remember, knowledge truly is power when it comes to safeguarding your health. Oral sex is a part of many adults' intimate lives, but overlooking its potential risks can lead to serious and sometimes life-altering consequences. The stories of Mr. Thompson and Mrs. Ramirez are powerful reminders that no one is immune, regardless of age or experience. Their recoveries were not simply the result of effective medical intervention, but also the willingness to seek information, ask questions, and take action. The most important takeaway is that open, honest conversations about sexual health are not only for the young or the uninformed, they are for everyone. Whether you're just beginning to learn more about yourself or have many years of experience, taking an active role in your well-being is always a smart choice. Empower yourself by staying informed. Ask your healthcare provider the questions others might avoid, and foster an environment where partners can speak openly about their health status. Remember, your body is your responsibility. Treating it with care and caution isn't a sign of fear, but one of wisdom. So the next time you consider intimacy, don't let myths or embarrassment cloud your judgment. Take the steps we discussed. Know your risk, protect yourself, and encourage those around you to do the same. The ripple effect of knowledge can save lives, maybe even your own. Stay curious, stay cautious, and above all, stay healthy. Please, if you haven't subscribed, consider hitting the subscribe button now. And if you have questions or experiences to share, don't hesitate to comment below. Your voice could be the one that helps someone else make a life-saving decision.